275,000 women die every year from cervical cancer. And there's two reasons why this statistic is even more alarming. One, 80% of these cases occur in low and middle income countries. And two, cervical cancer is a preventable disease. We know this because in high income areas with robust infrastructure, we see extremely low rates of cervical cancer mortality. The most commonly used method, the gold standard called the Pap smear, is used in Western countries, and it allows women to be screened early and to have precancerous cells identified so that they can be treated and their cancer does not progress to deadly stages. However, previous attempts to have the Pap smear implemented in low-resource countries have been widely ineffective. This is due to a variety of reasons, but some of which include the fact that the Pap smear is cost prohibitive for the majority of women living in these countries. Additionally, it requires the use of a cytology lab that's generally unavailable. Fortunately, there's another kind of screening method called visual inspection with acetic acid, or VIA. VIA allows midwives to screen women using only acetic acid, also commonly known as table vinegar, and their own training. The midwife simply applies acetic acid, waits 1 minute, and uses the naked eye to see if any aceto-white lesions appear, at which time she can treat women for precancerous lesions right there at the bedside. Right now, VIA is not widely used due to a lack of awareness of the method, but furthermore, because there's a lack of trained healthcare providers who are able to perform VIA and screen women for cervical cancer using this method. And this is where my organization comes into play. My name is Maria Young, and together with Julia Kramer, I co-founded the organization Visualize. Visualize is aimed at designing and implementing low-cost, high-fidelity cervical cancer screening trainers. These physical trainers allow midwifery students, midwives, and other trainees to practice screening for cervical cancer using VIA on a physical model. It includes a simulated vaginal cavity as well as a variety of custom-made tabs that show cervixes before and after acetic acid is applied. The training method allows users to train themselves to see the minute differences that sometimes occur when acetic acid is applied and aceto-white lesions appear. Additionally, it allows users to test themselves and get real-time feedback on if their diagnosis of VIA positive or VIA negative is correct. Our project is evidence-based, and it's based on over 6 months of ethnographic research of our time in Ghana. Julia and I have traveled to Ghana and spent time observing with midwives and working with them to co-design these trainers. At every step of our design process, we've gotten feedback from a variety of midwives and other healthcare professionals to make sure that the devices are appropriate for use in Ghana. Now we're looking to roll out a wider implementation. Previously, we've tested the devices on a small scale with one-day trainings in Ghana, and now we're looking to donate devices to midwives who are looking to train others and then follow up with those trainees to see if the training was effective. We're also currently working very specifically on local manufacturing, and this is where 2 of our biggest current challenges are occurring. We had 2 members of our team in Ghana this past summer working with a local nonprofit organization to manufacture our devices. However, we need help weighing the pros and cons of designing and manufacturing the entire device in country or manufacturing it partially out of country. Additionally, we need help understanding how to create the largest number of devices for the smallest cost. If chosen to present at the Global Health and Innovation Conference, we have several questions for the panel. One of which is to understand how we can connect disparate, yes, existing entities within Ghana who want to work on cervical cancer screening. We also need help understanding how to effectively measure and validate our short-term and our long-term training programs. And finally, we're interested in understanding how we can fit revenue-based models of having midwives and potentially engineers being paid for creating these devices into our not-for-profit organization. Thank you so much for your time in considering our pitch, and we hope to see you at the conference.